Latino versus Asian mental health comparison. In the Asian and Asian American culture, 3.3 of the total American population is Asian and Asian American. In the Asian culture, the mind and body are not seen as separate, however, they're seen as one. The Asian culture makes up not only one or two countries, however, it's 28 different countries, 28 different cultural beliefs, 28 different economic statuses, education, family values, religion. Due to cultural beliefs, seeking psychiatric help is seen as only a last result. The Asian culture is a collective, so mental health is kept inside of the family, so that way shame is not brought forward. There is a fear of being seen as lesser than and weak, because the family, being a collective, needs to be put first. What stays in the home stays in the home, out of fear of inappropriate stereotypes, and it brings forth more off-putting of your chi, which is a conflict due to your environment and self. The most frequent types of Asian cultural bound disorders are anxiety based. Coral disorder, for example, is an anxiety disorder mostly in Southeast Asia, and it's the belief that one's individual, male or female, is rescinding back into their body, followed by immediate death. Not only to save face, but an individual is not going to come forward due to cultural beliefs, folk, myth, lore. Some even say it's caused directly by evil spirits. Protecting one's family is not the only reason someone will seek hesitation. Due to trauma from PTSD, immigration, or even becoming a refugee, there's a stigma that one does not like to face. Cultural training and knowledge and language barriers are main reasons for mixed up. Bringing the traditions from their home countries, there are discrepancies in the appropriate ways that a patient should be treated. In the Asian culture, the main way to diagnose any condition is through the ICD-11, which expresses more into the cultural background. Successful treatment, it's essential for the medical professional to comprehend the cross-cultural lifestyle language, know the dietary and forms of cognitive and behavioral therapy, pharmaceutical treatment, educational classes, and family involvement have been the most significant forms of treatment. And Latino American prevention of mental health is due to lack of insurance, proper documentation, and economics. There's a fear of being weak and loco. Religious beliefs and folklore are other reasons, as well as it's a poor reflection of the family and friends. In the United States, 63.7 million people are of Latino descent. There are 20 different countries as well who represent the Latin and a Latin America country with different family dynamics, religious, personal beliefs, political affiliation. Health and wellness go hand in hand, majority with religion. And in the Latin community, prayer comes first before mental health. And it's kept behind closed doors. Successful forms of treatment for a patient is seeking psychiatric help from someone with the appropriate cultural knowledge to help identify the myths to diagnose these disorders. You need to have the right training and speak the proper language so there can be an open form of communication, and pharmaceuticals if necessary.